Hello, I'm Dr. Miriam Stoppard and welcome to this immunisation podcast. If, like many mums, you feel anxious about routine immunisations, I hope these tips will help make the prospect less distressing for both you and your child. It's normal and natural to feel anxious about immunisations. After all, no one likes to see their child in pain. But the most important thing to remember is that immunisation only takes a moment, whereas the protection it gives your child lasts for years. Please don't feel guilty about the immunisations, and more importantly, don't feel guilty about your anxiety. There are simple ways to help cope with your child's jabs, which are, after all, so important. Firstly, rushing is a surefire way of making both you and your child more anxious than you need be. Try to allow plenty of time for your appointment. On the other hand, don't arrive too early so that your child doesn't get bored and fractious. In new places, your child will pick up cues from your reactions, so stay calm and hide your anxiety. Then your baby will think there's nothing to worry about, and there isn't. Maintain eye contact with plenty of smiling and laughing, and importantly, lots of cuddles, as this makes your child feel secure. When you walk into the consulting room, greet the doctor or nurse in an upbeat way. Despite any nervousness you may feel, it's important to pretend there's nothing wrong, as your child will pick up on your mood. Sit your child facing you and keep eye contact, laughing and smiling all the time as normal. Distraction is a great tool. Take a favorite toy and start playing with it as a pleasant surprise. The nurse or doctor will be used to carrying out immunization quickly, but ask him or her to approach your child from behind. And you keep concentrating on and looking at your baby, maintaining eye contact and smiling all the while. Once the injection is done, the pain is usually over quickly, so congratulations on getting through it to both of you. Comfort your child if he or she shows any signs of distress with lots of kisses, cuddles and praise. Once home, be alert for any signs that your child is off colour or running a temperature. Try not to organise too many activities during these few days, and if you have any concerns, do consult a healthcare professional, if only to put your mind at rest. Your local pharmacist is a great source of information and advice, and is often very accessible. If the pain of the needle really worries you, ask your local pharmacist about products that might help numb the skin. If you do decide to use a numbing product, speak to your pharmacist who can advise you when to apply the product in advance to achieve the best effect. Above all, remember that you're doing your best for your child in the long term. Compared to that, a small prick from a needle shouldn't cause you to worry.